I have 3 ways that you can do it today to help you be successful for tomorrow. Seems like every business right now is making money with AI except the healthcare business, especially around patient care. What if I told you that you can use AI and some new changes coming next year that can really change your medical practice? The first thing you need to realize is that new revenue for programs that can take care of your patients is already there, but you're just not taking advantage of them. They're called remote patient monitoring, chronic care management. They're a part of a class of programs I call remote care as a service. The reason why a lot of practices didn't embrace this is because it was very frustrating to use these programs. They had all kind of frustrating rules and limited the number of times you can use it, how much data you could get in. They have to fit a certain 16-day parameter. You had issues around meeting thresholds of 20-minute conversations with patients. It was just very frustrating if you're a medical practice trying to implement this complicated workflow. Look, there have been folks who've already started these programs, but they just have not seen the money because, for instance, their nurses spent maybe 15 minutes with patient, absolutely phenomenal, great patient care, but they didn't get compensated for it because they never met that threshold. So this playbook is absolutely about to change. In 2026, the Physician Fee Schedule, which is the yearly rule book on how physicians will be getting compensated for next year, will significantly change how these programs are reimbursed. Today, we're just going to talk about these new rules. We're also going to show you how to use artificial intelligence to actually turn them into a powerful engine to provide the best patient care and new revenue for practices that have been struggling. Are you ready to learn more? If so, listen below and we'll get into these 3 reasons. First, look, are you even using these programs? And if you aren't, why not? Second, how can you use artificial intelligence to get started with these programs? And third, we're going to show you how to put workflows in place so you don't get burnt out. My name is Theo Harvey. I'm a serial entrepreneur. I went from lowly employee to CEO of a remote healthcare company I built from my home. I raised $1 million from VCs and investors and worked with large organizations like Cisco Systems, AT&T, Charles Barkley Organization, and Google. My mission is to help healthcare professionals prepare for the new normal in healthcare before it's too late. Let's get into the first point here. Are you doing these programs? And if you aren't, why not? Remote care programs like remote patient monitoring or RPM and chronic care management like CCM have been around for a while. In fact, these programs are very powerful. RPM, remote patient monitoring, is basically, in essence, you provide devices like a blood pressure cuff, a glucose monitor, a pulse ox, a scale to a patient at home. And that data is actually feeding back into a data back in the EHR or the database. So now the clinician, doctor, nurse can see this data and can make clinical based decisions on actual physiological data. So now they can change medications, they can understand what's happening with the patient's diet and exercise, and really have the patient at home because only 1% of the time is spent with the doctor. This allows physicians and other clinicians to get the information they need to care for their patients more effectively. Chronic care management is very similar, but it's just a nurse line. Think of it, if you have a chronic condition like obesity, you're dealing with diabetes or high blood pressure, having a nurse that can kind of walk you through the clinical reasons of why you need to change your diet and exercise, how different ways to think about it can help slow down the progression, because chronic conditions never go away, but they can be managed more effectively and extend a patient's life. So that's why these programs have been so powerful for so many years. One of the things too is these programs have demonstrated a significant improvement across healthcare outcomes. In fact, the University of Pittsburgh Medical Center for high-risk patients have shown they were able to reduce what they call readmissions, basically patients coming back from the hospital or back to the hospital after first being admitted. They were able to reduce those readmissions by 76%, which was significantly helping with better care, but more importantly, helping it with revenue so they can treat more patients. So these programs have shown clinically as well as financially to be very lucrative. I think this is why people are getting into it. But what is happening now? Medicare and Medicaid services, which basically sets the rules for how doctors and physicians will be getting compensated for the coming year, is finally acknowledging that patient care doesn't fit neatly into what they call these 20-minute blocks of outreach or these 16-day requirement readings. So this proposal introduces new codes for short-term monitoring. So for instance, patient can get a device in as short as 2 days. That data can be filled back into the physician, and now it's reimbursed for that time to look at that information. Also, the requirement for nurse outreach is down from 20 minutes to 10 minutes. So that means you can do quick things like outreach for pre-op opportunities or looking at medications briefly. Now you're not going to have to worry about a strict clock, because now there'll be opportunities to kind of have conversations with patients a little bit faster. So this shatters the old all or nothing thresholds that were in place before that really often penalize proactive patient care. So if you're going to do these programs, especially if you have a medical practice that treats a lot of patients in Medicare Advantage space that deal for a lot of chronic conditions, this is the time to start. Mark Cuban has said, you only have to be right once. Don't miss that one shot because you were afraid to take it. A recent study showed that nearly 40% unnecessary RPM interactions last less than 15 minutes. This is a perfect time to jump in and start putting workflows in place, so when next year hits, you'll be prepared to take advantage of the additional reimbursements. And this was time that was previously unbillable. So there was time that was used, nurse line, your time was being utilized, but you weren't getting compensated for it because they were unbillable. Now that's going away. Here's an action item, one action item you can do today. First, talk to your clinical staff. Look and document every remote patient interaction over the last 2 weeks. You want to include things like text after hours, quick phone calls to doctors, nurse staff conversations. And then if you don't track that, you can look in your EMR, your database of all your patient interactions to kind of calculate that information, or you can just look at your phone log. If it's difficult for you to kind of do that, we can help. If you're trying to figure out how to do this, we have AI tools that can pull this information. Our latest guide on AI workflows can kind of walk you through how to implement that so you can pull that data look quickly. If you want to check that out, it's the link below. Just go to sensormed.com/AI-workflow. But once it's done, it will immediately reveal the financial opportunity that your medical practice has for something like this. And it can really show you what's been missing. Let's talk about the next thing, how to use AI to start. It makes sense to begin with understanding, how your different patients interact with you. And because some patients need more interaction and some need less, right? So it makes no sense to get started if you don't understand that. For example, a post-op cardiac patient has very different needs than a patient with stable chronic conditions that just has lasted for a long time. This is where AI can be essential, right? Because it can truly leverage these codes to help you find patients and put them in different categories or different buckets, a term we like to call stratify or risk-stratify your patient populations. There's a quote that says, "A journey of 1,000 miles begin with a single step." Years ago, let me talk about one of my surgeon friends. He wanted to do all these wonderful things, right? Before they came in for surgery, he wanted to do pre-op interviews. And typically the patient comes in to do that, but he wanted to do it remotely, right, over the phone. And then post-op. So for instance, if their temperature went up after surgery, that was an indication of something that went awry. He wanted to put all these workflows in place, but he looked at it and he said, you know what? My time was just not available to do that.
Ain't nobody got time for that.
Because he would take time away from preparing for surgery or, helping the next patient post-op. He just didn't do it at the time, right? And it just didn't make sense for him. But guess what? Now's the time for him to do it. And the reason why is because the future is always changing. You can change with it. Let me say that again. The future is always changing. Can you change with it? That is what his thought mind was. And I think you have to think through that as well. I want to task you with creating 2 distinct patient profiles, right? You want to have one that's a short-term intervention, so like post-op medication titration, so making sure they have the right medications and if you need to change them or adjust them over time. And you want to have a long-term management bucket, right? So these are patients with chronic stable conditions. So this is a manual first step, that you can start preparing the logic for your AI to kind of, pull this information from your EMR database to determine how best to treat these patients. Another simple way, we actually have a masterclass on how to use technology to grow your medical practice. Spaces are limited. Please check it out below if you're interested in joining the next masterclass that can really help you and benefit your practice. Finally, the third piece is you need a workflow so you just don't burn out. Burnout is real for a lot of physicians and clinicians out there. We actually went through a terrible time where it was just tough for physicians to catch a break. So you don't want to experience burnout because you're just not going to be at the best to help your patients. There's a smarter way to think through this, right? With these codes, you're going to have a strategy to really assign the patients. You have to think through that. But how do you manage this at scale, without drowning in all the administrative workflow, right, that's going to come your way when it comes to delivering these type of programs? But the answer is you want to have a closed loop AI system that manages alerts and automates billing. And this is really how you're going to supercharge all your remote care programs like RPM and CCM. A healthcare CIO once told me, data is useless without action, and action is unsustainable without automation. Our goal is to turn every clinical alert into the right clinical action with zero administrative waste. There's a stat that says most physicians spend between 3.5 and 6 hours per day on EHRs. The average is about 4.5 hours daily. That's a huge amount of time documenting a lot of this information. And now you're going to get more data coming in remotely. It's going to be hard to create all this clinical documentation. So for in context, RPM, which you can automate time tracking, has been shown to increase billable time capture by up to 30%. And it really eliminates human error and forgotten entries. This is one thing that you can really start to do when you say, I want to make these decisions on remote care programs because I see it's best for my patients and best for my medical practice. I want to use AI so we can enhance and get the right patients captured. And third, I need to put workflows in place. You absolutely have to use technology to do so. One action item, we actually have an AI-powered RPM platform, SensorMed, and we can give you a demo to show the workflow in action and see if it benefits your medical practice and really gives you the potential of showing that new revenue and better care that you've been looking for. So look, if you want to check it out, there's a link below, sensormed.com. So in conclusion, I talked about 3 ways you can really show and take advantage of these new programs that's really going to drive more revenue for your medical practice in 2026. One of the things is, are you even doing these programs now? If not, why not? Let's start there because you can absolutely see the benefit of what these programs can do for your medical practice. And really the outcomes are what matter. Second, you want to use artificial intelligence to start stratifying or figuring out the category buckets for your patients. Some patients need quick outreach, some need longer outreach. Figure that out with AI tools that can help you with that. And third, you definitely want to put workflows in place so you just don't get burned out, right? You want to utilize technology and vendors that can help you put these workflows in place that can make sure you optimize on your billing, better care for your patients so that you don't forget. And third, make it simple so you're not spending tons of time documentation. I hope you like this information. In the comments below, let us know if this new flexibility will push you to finally try out RPM in your organization.